Welcome to Tech This Way.
Hey man, can you hear me?
Yup, I can hear loud and clear now, man.
Okay, cool.
I'm getting Hazwan in.
Okay, just send him the link.
All right. Sure will.
Happy New Year.
How's the year been so far?
I haven't left this seat the whole of January. Feels like it. What about you guys, man?
Going gangbusters lah. So it is havoc lah. A doctor on call, right? Because from a healthcare perspective, you're okay with me doing a little bit of a background?
Yeah, sure. We can. Do you want to wait for Hazwan, or we can start?
He should be joining us in a couple of minutes.
Why didn't you start lah? Give us a bit of background with DoctorOnCall before we get into background of you guys.
Oh, are we already recording?
Oh yeah.
Fantastic. Okay, so a little bit about DoctorOnCall, right? So started back 2000, late 2015, when we got this idea about the fact that healthcare, the cost was a runaway factor, right? And there was a lot of cool things being done from an online healthcare perspective.
Oh, hang on. Our good friends here.
All right.
Let me just let him in. Hazwan.
Hi, Maran.
Long time no see, man. Cool. Anyway, I see you guys are synchronizing backgrounds and all.
Yeah, I don't have that latest background. Yeah, but I'll just use this one.
Yeah. Anyway, so Maran just started saying that you guys started in 2015.
I mean, it was an idea that came out around late 2015, right? When there were a lot of I think the joke was that they were prescribing marijuana online in a couple of states in the US, and that kind of made headlines, in the likes of Facebook and the likes of it, and I kind of got caught by surprise. Oh, I didn't know that you can actually prescribe medications. Right? In this case, this marijuana was recommended as a medication, and that's when we started looking into the entire industry. And
so what was you and Hazwan doing at the time? How did it all start?
In the previous firm, Accenture, Maran was in Deloitte, or you just quit Deloitte and tried to focus on your clinic business, right?
Yeah, I had actually, backtracking, right? 2008, 2009, Hazwan and I were in the same project, right? Doing a lot of transformation work in Accenture. That's when we met. And then we kind of parted ways as I went on a regional role with Deloitte Consulting. So spent a lot of time in Philippines, with the likes of San Miguel, Indonesia, with Indo Food, and then back to Malaysia and Petronas, Thailand for a little bit of a while. And then I stumbled into the healthcare space when I acquired a small clinic.
How do you stumble into acquiring a clinic?
So a family member wanted to buy a clinic and then turned to me to actually seal the deal.
The man with the mullah.
The man with the also the man who had done a couple of M&As, and you can't. I mean, doctors are not really into the M&A space, although they know the craft really well. And that's when I got into the field, and I realized that healthcare was at least 10 to 20 years. I know it sounds a bit harsh, but 10 years behind the rest of the world in terms of adoption, digital adoption. Right, the kind of work that at the frontier, right, with banking, pretty much the entire field has gone online. Telco, airlines, right? And they are obviously, the last 6-7 years have been pushing ahead with fintech and all those innovations. The guys in healthcare was, I mean, just to share with you, there's like numerous hospitals without or clinics rather, they're still on pen and paper, right? And many of the hospital, perhaps chains, have standalone tech systems. So you can't actually go to a particular hospital, say in Ampang versus another one in Damansara, belonging to the same group, and actually have your patient health record transferred across. Right, which yeah, I know you kind of smirk at that or laugh at that, Amran, because you wouldn't think of an insurance company actually saying, sorry, my Batu Pahat branch doesn't have your data from Alostar.
Hey, the banks come from that background, man. There were branches, then they had the books, and that was it.
Obviously, everyone started off like that, right? Back in the 60s and 70s, and then perhaps in the 80s and 90s, we started integrating with all these big scale mainframes and hardware, right?
Yeah.
And servers. And then I
sorry,
think
then you had you got the clinic, and then what happened?
And then that's when we saw it was really required a lot of, we could infuse it with a lot of transformation ideas. Right, and a lot of improvements.
So you obviously went in with your Deloitte and Accenture mindset, like, let's not just do this the same way.
I'll butt in a bit, right? So I was on one of the large utility company in Malaysia. There's not many, but there's a huge spending on healthcare, right? So it's coming up to almost $1 billion a year. So I said. So in the last, even our life in Accenture, right? We focus on a lot of project transformation, digital cost cutting. How you transform your branches to become more digital and all that, right? We never really touch anything related to healthcare, which is like the most basic fundamental need of everyone, and that also come up with the biggest spending in any organization, and when you talk to even CFOs of any large organization, right, many of them actually don't know what to do with the healthcare costs. It's just expected to keep growing 20-30% year on year.
Right?
So
he was out there. Yeah. So he was out there. So why did you jump?
Why did I jump? So we had one catch-up session in KLCC, I suppose, and then he was telling me about all this. Oh, this is pretty cool. I have a few reasons why, right? One of the personal reason is like I think like one night at 4 a.m. in the morning when I was like doing work for the client, I said, why I work so hard for this client? If I can work this hard for myself, maybe I can do something, right? So that was the first time. Then maybe.
But that was already like 10 years of working at 4 a.m., right?
It's 10 years, and suddenly you realize. Suddenly you realize. But then spoke to caught up with Maran. He was telling me about this, and then I was like, okay, this is another coffee delivery idea or something, right? So it's just another startup ideas. Then I started to look into do research myself. In Malaysia, just for healthcare stats in Malaysia, knowing what I know from the $1 billion spent from one organization, and I just tried to check how many outpatient visits do Malaysians do on an annual basis. It's 120 million visits to the outpatient clinic. So on average, every Malaysian visits 3 to 4 times a year.
120 million a year.
120 million a year from the estimation. So that's what, 300,000 a day, right? So I was just doing
of 30 million, 120 million, yeah. Wow. People get sick a lot in Malaysia.
Yeah, I know that maybe you and I, we don't visit that often. Maybe we go once a year, right? But there are people who go twice a month, right? Yeah. So, so there's a lot of reasons for that, right? And then we start looking at it. Okay, I said this is huge market and it's largely untapped. And then we start looking at some of the trends in the US, by companies called Teledoc, Doctor on Demand. And then we also convinced, coming from, I haven't spent a single day in healthcare. My life was doing banking, telco work. So if banks can move from moving money physically to moving money online, and people actually come to trust the bank to do all that transaction, I'm sure we can do the same for healthcare. So that's how all this started.
So you decided to do the big leap and join Maran.
It was just like that, very easy. Like, I said, I think I took a short, some leave of absence, and then decided not to stick to this dark side.
So now that he jumped over, joined you, Maran. So then what happened? How did it all start?
We kind of like had a sort of a gentleman's agreement, right? Because we are, chartering into the unknown, right? So I have my little business, and obviously Hazwan was going to, get into this little venture, joint venture in which we're going to pump in money. We're all going to take obviously no pay for the foreseeable future, which has turned out to be 5 years of no pay, right? And multiple rounds of investments. I'll get to that later. And so I think Hazwan took a couple of months, probably close to 6 months for him to, chart out the strategy, because that's where he's more focused on, while I jumped straight into the process flows, right? Mapping the process flows, because, you can't buy a solution off the rack, right? Realized that, digital solutions were really not very easy to come by in Malaysia.
So from a model standpoint, what was the big idea?
So the model was like, so there's many ways to get into online healthcare, right? Some people come into telehealth, others come into online pharmacy, some goes to the specialist booking platforms, and patient health records and likes of it. So we had almost like a Jeff Bezos moment, right? They say like, what is the easiest category that you can get into? So obviously he got into books. His other idea was into CDs. We looked into the entire space and realized that, or made a bet that telehealth was going to be the easiest field to get into and convince Malaysians to talk to your doctors through chat, phone, and video, right? You could be in a time-strapped executive in KL with loads of doctors around, but you just don't have time to get to them. Or you could be in a rural area and require, to talk to a person for a very specific niche, right? Let's say women's health or men's health. And so we got into that, and we were the first in Malaysia. So there was no real solution around it. I ran a couple of tenders, couldn't find, and talked to a couple of vendors, couldn't do it. So I roped in a couple of developers, and then took my first flight to India, right? First time in my life. Went down to Bangalore, and there was some really bright young guys who created a back-end solution and worked out with them. So the joke is, the first time I went there, silly old me, I forgot that they need visa requirements, so they turned me at the airport, turned me around and sent me back. And so when I told,
where's the immigration on call when you need it, right?
And so, when I tell a couple of family members who had been to India before, right, they were all laughing at me, going like, because I used to live off a suitcase from Indonesia to Thailand and Philippines, and you forget that, you need a
and
visa.
Somebody sorts out your visa for you, right? So that's the thing.
So the second time around, I was better off, worked up with those guys. I mean, of course, it's incredible. Like you get to India, everyone expects you to understand Hindi or whatever they speak in Bangalore, but you don't. So you're a real coconut over there, sitting in third floor of a shop, like in the middle of Chowkit, like kind of area which has power outages 5 times a day. And every time they have a power outage, everyone goes out and has a smoke and then comes back in and sits on the beanbag and code. So did that for a little bit of a boot camp. came back to Malaysia, and then started launch our beta version around April, May 2016.
So was this to
Right.
find a platform where you do like a doctor on a Zoom call? Is that what it was?
Exactly. Before all of this, Zoom calls were so easily available, right? But also the fact that it needed to come along with a solution where the doctors can issue out a prescription, a referral, an MC, have the patient health record, right?
Sorry,
all of that
Hazwan.
encapsulate.
Yeah, I'm just adding that. Yes, I think when we first started, people are saying, "Oh, it's just like doctors on FaceTime, right? So what's so complicated about it?"
Okay,
right?
like 5 years ago, it wasn't Zoom, it was that.
FaceTime. So I mean, we had a hard time like convincing people. Actually, even for us as well, right? Yes, if it's as simple as FaceTime, why bother, right? But there's a lot more to it, right? There's patient privacy. How would the doctor record their interaction with the patient, right? It must have a proper format for prescription. And what is that security model, right, for doctors? Because you can't have doctors who can. So there's a couple of tricks, right? So you can't have a doctor who can access the patient record of all the patients, right? So the doctors can only access their own patient or their own record. So there's for that, during that time, if we were to start off from, just drawing our own process, our own protocol, we might have missed a lot of things. So that's when we went to India and discovered that they already have a few telehealth company and they have figured out that protocol, right? And then we just adopt that and then and come up with our own, right? So there's a lot of sensitive data and whatnot that we need to think about, and it's not as simple as a FaceTime doctor.
So as far as the DoctorOnCall is concerned, right from the start, so you've gone to go find this platform. What about the doctor side, and what about the patient side? How did you start that?
Yeah, so what we ended up doing was, leaning into a couple of friendly doctors, right? And who were, so what happened was actually in the initial portion, there was a couple of really smart master's students, right? Doctors, that is, right? Who were just, I suppose, just came back from wherever it is, like whether it's Ireland or UK, and they had seen this, right? So they were open to the idea because I would say the veterans in Malaysia who've been running their own GP clinics for the last 20, 30 years, just coughed at the whole idea that you can't do this, how are you going to do that, you'll never take off, and whatever and not. But these smart guys were really very helpful. And they also, like what Hazwan actually sat down closely with them and worked out the medical protocol, right? So from the whole so-called bedside manners, which we now translate into conversation manners, right? To eliciting information, obtaining arriving at history taking, the diagnosis, and how to prescribe and what to prescribe safely. I mean, obviously, we are not doctors who say what to prescribe safely, but we then looked at American Telemedicine Association. They had a lot of protocols by dermatology or psychiatry or the various kind of specialties. We kind of transposed that across to Malaysia, worked out with the doctors, and kept on, iterating.
So right. on day one, how many doctors did you have? And how did you convince them? I wanted to understand. So right from day one, right? Okay, how many doctors did you have? And then how did you then get customers or patients to go on the platform and then knowing that there's these few doctors? How did that start?
I can take that. So I think day one, we have maybe 3 or 4 doctors, right? Yeah. Working, not full-time, but semi-permanent. We are building the protocol together. The thing is, when you asked, at first we said, okay, here's a platform. Okay, start consulting with the patient online. We have quite, this is also the first time the doctors are interacting with patients via this video call or audio call, right? So there's a lot of hiccups, right? So it's
Sorry, were they part of existing clinics, or like you said, they just graduated?
There are a few friendly partner doctors, I would say, from a few clinics.
Okay. Okay, yeah. Sorry, go on.
Right. Yeah. So even when I asked about 10 doctors, okay, tell me, right? I'm putting in my process hat, right? So it's like, okay, when the patient walk into the room, right? You know, what is a step 1, step 2, step 3, step 4, step 5, right? Because we are thinking of there must be a standard operating procedure when the moment the patient walk into a room, but there really is none. That is, so the doctors say, oh, maybe it depends on the situation, depends on this. So if we were to create the same experience, the same in-clinic experience online, we need to make sure that things are done properly and in a very consistent manner, right? So even the first thing, like, okay, you have to introduce yourself. Hi, I'm Dr. Amran. How may I help you, right? So even that greetings is a standard protocol that needs to be reminded and over and over again, because over online or video call, the patients are a lot more sensitive, right? So you have to, you need to make sure that everything is done in a good and consistent experience, so that there's no complaints, right? Else it become like a bit like a customer service effect where patient get angry and then start scolding everyone over the phone.
So is this on video or is it purely voice?
Both. We have both options for patients. Audio and video for prescription, and also chat for non-prescription interaction.
And this was right from the beginning, like you guys had that?
Right from the beginning.
Yeah. Okay, so then how did you go out and get patients?
Okay. I'll take that. So when first started, we of course we don't know how. We know there's doctors, we know there's us, right? Patients, right? But there are other players, so-called payers in the healthcare space, right? So there are insurers, there are third-party administrators who manage the payment to the clinic. So those are considered payers, right? So if the clinic is not on a panel of those payers, then you can't be considered for service. There's also providers, right? So people who are managing the doctors and all that. What we discovered is in Malaysia, so we sort of follow the money, right? So who are paying for, who is making the decision for healthcare, who are paying for healthcare, right? So if your employer is the one say that, okay, this clinic A is, you can use clinic A as a panel and we'll pay for it. So we go for, we're targeting the payers. It took us the whole year, 2017, to convince. We went in and out, I think about 90 institutions, you name it, colleges, universities, banks, telcos, everyone, right? So out of the 90 companies, I think 9 gave a soft okay, right? It's about 10% gave okay, and I think we ended the year with 2 clients, right? Who said, okay, we on board, we pilot your service. So those are the, so because we were the first one, there's no precedent. So, but the first 2 clients were insurance companies. And then they say, okay, this is, I've seen this done in Europe, in European or America. So let's try this out, right? So from there, once you have the payers, 2017 we have 2, and then 2018 we have additional another 8 payers who come on board, and that's when we started to get the attention of patients as well as providers, namely doctors and hospitals, right?
So with the initial 2 companies, how many actual client-doctor interactions did you guys have at the start?
Okay, I can't really remember that initial transaction, initial number now, but we probably do about, during that time, we probably do about 10 to 20 calls a day. That's all.
Sorry, 10 to 20 calls a day? That's pretty decent volume for your first year.
Yes, it was after 2 I think after a whole year we reached about 10 to 20 calls a day during that time. But it's still not enough, right? So that time also we realized that the visit to our website, a lot of people don't know about the service. We only have about 10,000 visitors to our site on a monthly basis, right? But I think 2018 we changed our strategy, tried to acquire more users in a more sustainable manner instead of paying Facebook and Google marketing and all that, right? So we developed our own in-house strategy. We end up 2018 with 1 million users, right, Maran?
Yeah, I mean, it was more close. It was more like, yes, you're right. In total, right?
1 million viewers or registered users?
No, more like
visitors to the site a month. Yeah.
Exactly.
To the site. Okay. So let's go back to the model a little bit. So a patient goes on doctor on call, gets what do you call it? An appointment with a doctor, right?
Consult,
now,
yeah.
A consult. Now, normally, if it was a physical clinic, he finishes the consult, goes outside, and then waits for his pills, right, at the clinic. So how does it work on doctor on call? So I've done my consult. Now, how do I get my prescribed?
Yeah, so it's actually we've actually understood that, right? Because in Malaysia there's no separation of prescribing and dispensing, right? So unlike in the US where you got to walk across the road to the pharmacist and get the medication, in Malaysia you just go to the counter and there's a nice kakak over there who's going to be putting everything in a nice box and explaining to you about the medication consumption rules, right? Now we then coupled it, right? As soon as you finish the consult, the doctors will type out the prescription in about a minute or two. That will translate into an order that gets sent to your mailbox or to your through SMS. You can click on that. So that will now translate, right? One box of ABC medication. Now it's going to say it's going to be 20 or 50 ringgit, right? And then what you do is you can you can make the payment. Right, we can make payments to a whole variety right now, right? To credit card, debit cards, Grab, Touch and Go, the whole works. Or in the cases with the payers, like what Hazwan had mentioned, it will be absorbed by the payers based on their specific benefit rules. And so now that will then, you just need to put your address and the medication will be delivered to you within a few hours. So in most major metros in KL, in KL, Klang Valley, JB, Penang, it's going to be done within a few hours. Some people are shocked to see it being delivered within an hour or two, right? While the rest of Malaysia, some more, rural areas, you'll get it the next day or 2 days from now. But the beauty is because of the fact that we understood the lack of separation prescribing and dispensing means that the medications in many cases are very high in terms of their prices because there's a lot of margins built into it. So by us actually negotiating directly with the pharmacies and buying in bulk, because our volumes are pretty significant, and we have also applied a lot of modern procurement methods to actually really strip out the cost. Many of our medications are between 30 to 60% more cost effective for the same SKUs, the same drugs, right? And so that was a real big, I suppose, draw card to either the retail patients or even the corporates and insurers, right? Because to what Hazwan had mentioned about the whole 120 million visits a year, and I could see you going like, wait a minute, how do you visit clinic 4 times a year? The trick is this, is the 80-20 Pareto rule, right? Folks like you and me probably visit once or twice a year because of a wrong prawn that you eat and you get diarrhea or something, right? Food poisoning. But there's a 20% that actually suffers from chronic conditions like diabetes, hypertension, heart problems, asthma, those kind of stuff, right? And so those are not episodic in nature. They are chronic, and you got to take the drugs on daily basis, and you tend to replenish on a monthly basis. So now they are the ones who spend $300-400 a month, some up to 300-400 ringgit, some even higher. And that 30 to 60% cost saving really means a lot to their bottom line, right? And so that is one of the primary focus of our mission, right, which is to provide more accessible and affordable, as well as what Hazwan was mentioning about high quality consults. We don't want, a lot of people complain, and I see this even in the running of the clinic, right? With Dr. ABC, the guy takes his time to understand you. With another doctor, it's really, straight to the point, right? The other doctor doesn't know about women's health, right? Maybe more into pediatrics or whatever, although they're GPs, right? Or doesn't know about men's health. So what we wanted to do was provide a more standardized so that you don't come to a doctor on call and suddenly, one day good doctor, next day lousy doctor, right? And but that's what you tend to get when you go to the clinics, because there's no standard, there's very little standardization. Because you remember the clinics market is very fragmented. There's 8,000 clinics in Malaysia, and the largest chains only have 100 to 200 clinics.
Wow. So the
So
rest of the
most clinics
majority are all individually owned. Huh?
Standalone. They left, so they've been practicing their own for the last 20, 30 years. And so they're not, they will have developed their own clinical practice guidelines, so to speak, their own SOPs, right? And so that is one of the major push by us in over the years, 17 and 18, until what Hazwan was mentioning, we secured the insurance companies. And I think one very interesting tale is this, Maran, that when we dealt with the insurance companies, because we were always dealing with the retail clients for the first year, right? The first years, 16 and 17, right? So a lot of people who came to us actually were coming for, like it or not, for better or worse, it's mostly to do with women's health, men's health, and sexual health. So whether it's missed periods, right, or the day after pills, or some I suppose STD-like symptoms, right, or some very private matter, right, with men's health and women's health, right, around sex and family planning. You can remember we're a conservative country, right, and in which we, what did you learn about sexual health back in high school? Right?
None.
Yeah, it was none, right? And so, and people can't talk about it openly. And if you're going to be standing outside a OBGY or STD clinic, people are going to be asking, what's a 19-year-old girl or 25-year-old man doing over there, right? And so, a lot of people really would need of this, and so they liked our platform, right? They liked
doing it privately, rather than going
privately.
Physically. Okay.
Exactly. And also learning, right? Because you suddenly say, doctor, I got this, unfortunately I got this discharge, or I got this particular condition, and so on. How do I go about that? And you want someone with empathy to explain to you, it's not all HIV, not all doom and gloom, right? And so, and guide you to that process. That's when we also started discovering our niche, right? In which we realized healthcare education is very weak in Malaysia. There's no WebMD or helpline in Bahasa. Right, so if you type in the word, and Hazwan has got a lot of stories, right? But type in word kencing manis, darah tinggi, and you say, ubat mujarab, 100%, money back guarantee, right? We choose pegaga, this and that, right? Everything will tegang, everything will cure, everything will this and that. And you're like, look.
Even if you don't search for it, it'll come to you.
So it's like, I really feel pitiful for people who don't have a health card and don't have a Pantai KL or Mediviron down the road, right, where they can go and talk to an educated doctor, right? You'll be buying this rubbish and worsening your diabetes condition and your heart problems and whatever fertility issues that you have and so on. So we started writing hundreds. Now we end up with a repository of close to 50,000 articles, videos, listicles, FAQs, Q&As in primarily Bahasa as well as English, right? And now we are getting about 2.5 million people visiting us on a monthly basis.
Nice.
Yeah, so it was like a time when we were, I think probably for 17 and 18, I think a lot of people visiting us were from a younger demographic, right? And we were known a little bit like a STD clinic or men's health or women's health clinic. But as you can see with any digital adoption, I suppose the early takers, right? The early adopters are always going to be folks who are more used to the digital world, right? They already live their life on Netflix and GrabFood and Foodpanda, so making a jump to online healthcare, they're not going to be coming with a baggage of like, I got a 20-year-old relationship with my doctor from the neighborhood. They will adopt that. And that's when we managed to prove our use cases to the insurance companies, right? Hazwan, perhaps you want to tell a little bit about how we actually started working with some of the insurance companies, right? Because it ended up being a major SI kind of project, systems integration project, like.
Yeah, sorry.
Yeah, so
Before you go into that, right? From a regulatory standpoint, do you guys need to have a clinic license or something like that to operate?
So I can take that as well. So when we first started, we also searching high and low in terms of what are the laws and regulations that is governing digital solutions like telehealth, right? So we have one very forward-looking act called Telemedicine Act 1997. But in 97, you see like the technology like smartphone and all that is pretty much like non-existent, right? But that is the only act that was passed by the parliament during that time, and we in 2017 itself, the first few months of our go live, we engaged with KKM, the e-health unit, try to share what we have and what we have seen, and they are very welcoming in terms of our effort. But then they were also very forthcoming about actually the regulations needs to be reviewed. Right? Because the 97 Act is not ready, and then the old Medicine Act, like Private Healthcare Facilities Act and all that, does not cater to digital platform. So for us, it's all about our business is a platform business, but we make sure that we follow the existing law. For example, the doctors must be legit doctors. We verify their APCs, annual license, and all that. And then the dispensing of medication is done by the proper by the licensed pharmacist, and it's taken. It's not from my kitchen or from my backyard, right? So all those are followed quite closely. And then it's been 3 years now. I mean, of course, we spent the whole year engaging with this group. Initially, it was called Telemedicine Development Group. And then after it's called Digital Health Malaysia. This is the industry versus regulators joint committee to discuss about the healthcare, digital healthcare regulations, and how do we propose something for the benefit of the future. So the 2 trees, 2018, 2019, we're still engaging, but of course there's no specific outcome or announcement. There was talk about moving to digital health. And of course, as everyone knows, COVID-19 expedited a lot of things, right? So 2020 is the first time that Malaysian Medical Council come up with the telehealth guidelines for the doctors. And then that's when the doctors feel a bit more comfortable to start practicing online.
So you could operate anyway, but it was almost like up to you guys to make sure that you do your own due diligence.
Self-regulate a lot, yes.
Self-regulate.
Yeah.
Okay.
Yeah. So I think MMC has come up with the first guideline for telehealth this year, and KKM and also MOSTI are working on the National Technology Innovation Sandbox and also regulatory sandbox within it, where they will. So this is definitely a good move, right? Just like banking sector, where you have a sandbox to test new technology like fintech. So this is the sandbox for the digital health players, like a platform like ours. Yeah.
Okay. Sorry, so I interrupted you just now. You were going to talk about the insurance story.
Right. Well, maybe since we segue into regulations, right, I think it's worthwhile also sharing the fact that as we were engaging with Telemedicine Development Group and Digital Health Malaysia, we were also testing the boundaries of some of the old laws, right, which were pretty restrictive in its interpretation of displaying of medication, of explaining about particular conditions, right? Because there are some acts which have a very strict, narrow interpretation of advertisements, right? They don't even allow for people to display information about a particular product because it's then deemed to be advertising for the drugs, right?
So you're talking about during the consult itself, the doctors are not allowed to say, "Hey, here's a bottle of XYZ," kind of thing, or is that what
No, I'm referring to the fact that we can't even have, as part of our website, that says this medication treats this particular condition.
Okay.
Right? Because typically people will research, macam mana nak, solve this backache of, whatever toothache, right? And then, when you see those Panadols and those particular conditions, you go like, okay, let me click here and talk to the doctor to get a prescription for this particular medication. So we have tested that in court at least 3 times, right? Because without a very clear set of guidelines, right? We decided that, okay, when we spoke to our lawyers, they said, look, you do it, right? And so go ahead and do that. But obviously,
when you say do it, meaning in your FAQ, you're actually saying
in our
Panadol,
website.
use Panadol. Okay.
We say, use this particular drugs, resolves this particular condition, or this doctor treats this particular condition, right? And so the challenge is with certain parts of the ministry, they have a different interpretation of that, and they have actually taken us to court for it. Okay. So it's actually a little bit of the wild west, right? In terms of the fact that I can imagine many people, being shocked, right? Because about the fact that we are hauled to court, we have to hire expensive lawyers, we have to give interpretation, and we had to battle it out for long periods of time. I think we probably spent like a better part of 2.5 to 3 years working out some of these cases, right? And that's when we actually, because right from the start we were engaging Ministry of Health. And we were showcasing to them how it was being done, hundreds of millions of consults and medication deliveries and medication purchases and treatment bookings, and all are being done in US, China, India, and the likes of it, right? Because these are vast geographies and they've got large populations, so they can't just solve everything on the old school method, right?
And whilst you can understand why they're doing it, right? But on the other hand, you guys are doing it with a lot of control, self-governance, if you like, right? Whereas I can just Google the same info from some don't know what fella who decides to post it, hey, you know what, you squeeze some of this and add some of that, use, and then it'll fix, right?
So exactly right? I mean, like so many of these unscrupulous guys are dumping this on e-commerce websites, right? Whether you want to grow hair or grow fair or grow whatever, right? Lose weight, right? You have all of those in there. And instead of actually, and it's really hard to govern it. That's why we say that we need to come out as the credible player, right? We need to come out as an online clinic, a digital hospital.
A trusted site, right?
Yeah, a trusted site where people will come to us and still maintain their privacy, still get things affordable, and it's been a very stressful journey during that time, right? Because again, we're not seasoned court goers, right? But I remember
I'd be worried if you said you were,
but of course we shared the same halls as the ex-prime minister, right? On some occasions, right? So Hazwan will be calling me and say why is the whole court full with people waving flags, and turned out that our court day was on the same day as him, right?
Surely you're not getting that much support, right? They're not turning up for you,
No.
Fairer healthcare digitally, right? Yeah.
Exactly. So it's been a really interesting journey, right? Working out with regulators, working out with lawyers, working out with doctors, because nothing is carved in stone, right? Everything you just got to basically build a plane as you fly it, right? And regarding that, maybe Hazwan can tell you how we've been working with the insurers, because that's also a case of thank God we had some experience with SI and large scale implementation, because these guys are tough, demanding set of clients.
Yeah, I think in a lot of digital platform, the first set of clientele would be retail users, where you just do some marketing and then acquire the users, right? Since our initial growth needs to be fueled by corporate Right. So when we first started working with the two insurers, there's a lot of things. Of course, you know how corporate we have like multiple layers of checklist, and so I remember they're asking for SOP, right? So what did when someone asked for SOP, right? What we did was we had to come up with those documents. So it's a method. We did it overnight, like 30-page document. Did it overnight, every single step, every single thing that we need to come up for the platform, and that's when I appreciate. This is what we do in our previous life.
Yeah.
So
and you always complain anyway, right?
Yes, yes. So it's we work very at the end of the day. Experience came in handy in terms of thinking through of the detail. How does a corporate thing? What are some of the concerns for the corporates and MNCs? And we work well with them, right? So we are probably one of the more corporate friendly startup around, right? So any implementation is done in a proper project, proper timeline, project management, and we have been. I mean, imagine doing 3 or 4 clients simultaneously in the previous life. So this is the same thing. Yeah.
So going back to the doctors themselves, right? So how did you guys scale up? So you initially had your 3 or 4 doctors in the beginning, and then how many do you have now?
Now we have close to 1,000, maybe 100. 100 of them are on-demand GPs, and then about 900 specialists just onboarded just last year, right?
And are these all locals?
Yes. Locals, yes. They are all MMC registered with the annual practicing license. So for the first 50 doctors, right? I think number speaks, right? Because our platform is borderless, right? So they're not limited to their clinic in Taman who receive like maybe 10 patients a day or 100 patients a month, right? So right now they can serve a doctor in Penang can serve patient from Sarawak, Sabah, right? And we open every day 8 a.m. until 12 midnight. So a lot of doctors feel they are able to expand their income by this platform, and some doctors make up to 4-5 grand additional money a month just by seeing their patients online, right? And the number speaks, right? So that is a significant income for a GP doctor. And secondly, of course, when you have more providers on board, a lot of doctors are more than willing to provide their services for the payers. Right?
So from a customer journey standpoint, so I log on. So now there's 1,000 doctors on the list. How do I get assigned to a doctor?
So
there are 2 ways. One is on-demand clinic. So you can just, I need to speak to a doctor now. So this is only available for general practitioner service. You can just click a few buttons, make payment, or if you are part of insurance companies, insurance members, you don't need to pay anything. Then any available doctor will pick up your call within 3 to 5 minutes.
How does that matching work? Is it like a Grab rider? The first one to accept the case gets it.
Correct. So we make sure there are doctors every single hour of the day, from 8 a.m. until 12 midnight, right? And we have since then identified peak hours. I mean, the peak hours are always in the morning, after Maghrib, and close to midnight.
Strange. Yeah. I guess in the morning it's like, okay, this thing didn't clear up after I wake up, so I'll call. Or I guess Maghrib is like, the whole day I better get somebody after work, right? And then midnight is I cannot sleep, I better call the doctor.
Yeah. Just imagine patient with gout condition wake up in the morning with foot pain and needed some medication, too painful to walk to the clinic, for instance.
So if I wanted to talk to the same doctor, so I build a relationship with somebody, is that available?
Yeah. So you can go to the site and you can book a specific doctors or specialists. So you can search for, say, Dr. Maran, who's a endocrinologist or someone, right? you can see his calendar and book a time. Of course, we are now building, getting more and more doctors on board, right? Either you're looking for doctors with specific specialty to get the first appointment, or you have some of your existing doctors available on the platform. You just want to continue your consult online.
So Maran, the clinic that you first bought over, are they online too?
Well, actually, they were they're definitely in the early days, right? And they kind of like supported in the initial days to guide us, because we were actually in the early days working off the storeroom of the clinic. So
Hey, got to start somewhere.
two programmers, two customer service, Hazwan and me. Definitely not COVID-19 friendly environments, right? in a 300-400 square feet, and then just opening the door and hollering at the nurse and going like, how do you actually do this? How do you do that? And then going to the next door and borak with the doctors about like how do you go about treating some of this, right? And actually, I just also wanted to pick up on what you said, Amran, right? I think like 3/4 of Malaysians, right, start in the healthcare journey online, right? So they don't actually come to DoctorOnCall saying like, I want to talk to a doctor. They actually start by saying like, where do I get this best treatment for here, right? Who do I meet? Like, I mean, I bet you 9 out of 10 Malaysians don't know what an endocrinologist do. Neither did I prior to getting into this industry.
Me, okay?
Okay, so the whole Latin, multi-syllable OBGY, urologist, cardiologist, cardiothoracic, just escapes most people, right? So most people start off by going like backache, front ache, toothache, whatever, and like, why am I urinating so much at night, right? What I gather, and I'm not trying to give advice right now, it may be a early symptom for people suffering from diabetes. Right, and same reason. I mean, I can learn how conditions like ED, erectile dysfunction, right? Since it's a private matter and people do ask questions around that. Also, it's an early symptom of these most serious conditions like diabetes and heart problems. So you know how I mean, we observe some really funny trends, right? How women are a lot more educated and conscientious health seekers. So they come in saying like, okay, my kid has been having this different kind of gait or walking kind of condition, or my dad's always very tired, my husband's facing this issue. But men tend to come in and going like, how much is the Viagra? Right? Well, our doctors have to educate them and say, look, it's not about that only, right? You have to understand that you may be facing obesity. I mean, we are the fattest country in Southeast Asia, and fourth fattest, more obese in Asia, right? So it may be due to that. And you're saying the symptom about fatigue, about low hormones, about and all these conditions, because it's early warning for that condition. So people start off by asking these questions, getting into DoctorOnCall. Now, we are like 2.5 million people visiting us. So we're effectively the wiki for healthcare in Malaysia, right? People come to there, they read the articles, then they see the plethora of options. They can talk to a GP, they can talk to a specialist, they can do a health screening, they can get a nurse at home, right, to take blood for you, right, and proceed. Or they can even go to online pharmacy and proceed. So that's what we envision to do right from the start. And it's really been a fortunate point to actually arrive at this place. And we're beginning so many reviews. I mean, if you go to our Google and Facebook reviews, you'll see like at least 10 to 20 a week, right? Of people going like, wow, I didn't know I can get things so convenient, so accessible. I mean, we got people, looking for cancer drugs on our platform, and they actually, that 30% savings translates to a few thousand ringgit.
Oh, for sure.
Those really expensive. Yeah.
2 questions before I forget. Number one is, now we did talk about, well, you mentioned that your access to patients is borderless, right? Are your access to doctors borderless too? Meaning, can you get doctors from outside, from India, to service Malaysians?
Yeah, perhaps I can take that, right? So it's interesting how there's been a couple of companies that do that, right? So they get you to a doctor from the Philippines because it's just downright cheap, right? So it's like, a couple ringgit, you can get a doctor from India or Philippines. There are another bunch of sites that actually uh, claim that they can get you a specialist, right? For very, very niche fields, right? Again, in a pretty affordable manner because they happen to be in India or those kind of countries. Or obviously, some of them are in the US, so they're more of a specialist site. What we have been going, if you notice, we did telehealth, we did medication delivery, online pharmacy, healthcare content, then labs, hospitals, and home nursing. And I think as it's been a building that product, and then of course building the insurance product, building the corporate product. So we built multiple products, probably like 9 different customized products at this point of time. And I think like moving forward, we just signed a MOU with Malaysian Healthcare Tourism Council, right? MHTC, right?
Didn't know
In
there was
which,
one.
yeah, MHTC really a great organization that's helping Malaysia really showcase our healthcare, because we got really good healthcare, right? And plenty of people come from Indonesia and around the region, China to and Middle East to Malaysia, and so they're putting out the map, putting Malaysia on the map, and we are helping them from aggregator, so like trying to be the bookings.com of and being the telehealth provider. So think about it, like if you're stuck in I don't know, Medan or Surabaya and Jakarta, and you've been hearing that how great the doctors in Glen Eagles and KPJs and Makota in Malaysia are, and it's very hard to take a flight and come down here without knowing anything. So you want to talk to the doctor, tell about your condition, find out the price range, prepare your money, come over here. Those big ticket items like hip replacement, and those kind of stuff, right? So that's where we are working, and I think currently we're focused more on inbound to Malaysia.
I see.
Because Malaysia's got good doctors, right? So I think unless you have a very niche requirement, then you need to go to the region's best, which I suppose some of them are in Singapore, right? And of course, like if you really face those serious conditions, I know conditions which can't be treated in Malaysia, then you have to go to US and Australia and UK, right? So, but right now we're focused on this because I think the Malaysian, from the statistics that came out, our medical tourism, medical travel business has been slashed by at least 81% due to the impact of COVID-19.
And
Right?
that was my second question. So this time last year, we were like, okay, what's going on here, right? And then suddenly March came and boom, everything was under lockdown and things like that. And instinctively, I would think, wow, that must be good for you guys, right? The fact that people can't travel, but they can get the doctor on call. How has COVID been for you guys?
Hazwan, you want to take that?
Yeah, I think it's good generally for the digital marketplace and platform like ours, but it was not automatic. It takes some time for people to get used to seeing doctors online, and it also takes some time for doctors to learn and provide an acceptable level of service to the members, right? Because if members are paying certain amount for this, they expect certain outcomes, right? And we have to educate the patients that there are limitations to this channel. Look, some doctors say, look, I cannot continue this giving this teleconsult. You must come for physical assessment, right? So things like that, we are refining it over the month. But in general, yes, our platform has grown quite significantly over 2020, right? I think about 4 or 5 times than our initial expectation.
Nice.
Yeah.
Now, so you were talking about the physical aspect of a consult, right? So how does that work?
Yes.
When a patient comes in, talks to the doctor online, and then suddenly the doctor decides, oh, actually, I need to touch and feel, right? So how does that work?
So, okay, I can answer that. I mean, from the early days, I have always imagined our platform to be an online to offline, eventually become offline model, right? Because for healthcare cases, illness, you definitely cannot do everything online, right? At the end of the day, we need to connect to the physical services, be it lab testing, be it COVID testing, be it dengue testing, physical check, and of course treatment, surgeries, and all that in the tertiary care. Right. So we have built our business starting with digital, online, getting a lot of people to come to the site and start using our online service. And last year we expedited our offline connection to offline businesses, right? So we started with booking for doctors, booking for COVID testing, and then we launched.
And this is
our,
bookings at their own GPs, the clinics.
Yeah, bookings on the platform for physical meet. Right. So if you think about it, many clinic or even banks, right, you start to introduce the appointment booking concept. So you can't just walk into a branch.
Yeah.
Now everything needs to be booked. Even KKM took that spearhead the way to booking, right? So now you cannot just walk into a clinic. Kesihatan, you have to book. And then once you have the appointment, you can only go there unless you have an emergency. So that comes very naturally for users to start doing that. Secondly, we have more and more so-called offline channel. So talking about the testing channel, we introduced this product back in September called Doc at Home, where we can send nurses to do minor physical assessment, as well as taking your blood to be sent to the lab to produce your lab report, health assessment, health screening, and then you can then upload or discuss with the doctors on your results without actually having to come to the clinic. Right. So all this thing was made possible through this pandemic year. Yeah.
One last question from me. Competition, right? So you guys sounds like the first in 2016, 2017, right, to set this up. How has the competition been up to now?
So, taking a bird's eye view, right? Because we didn't have the privilege, the benefit of actually having a chain of clinics or pharmacies or labs to start off, right? We then took but we studied how it was in the US and China, and whether it's Ping An Good Doctor or We Doctor or Ali Health, or even in China, in US with American Well and Teladoc, which are public listed organizations, they took a platform approach, an ecosystem view, right? So it wasn't Hazwan's clinic or Maran's pharmacy, right? It was a platform where all the doctors can set up shop if they have the right certificate, and the licensing and insurers and the retail guys can come in, and the pharmacists can come in to provide the drugs. So we were fortunate that we had some really good partners, right? Like Allianz and AXA, Zurich, Great Eastern, Prudential, which saw, obviously these are multinationals, they seen it around the world, so they were heartened by the fact that we could provide high SLAs, integrations, and customer service to meet their standards. And so remember the 30-page SOP that Hazwan created overnight, and so it was all those kind of stuff, and the constant training to the customer service team and so on. So that was, so they latched onto that. The customers latched onto the thousands of contents that we spent. So we spent millions of dollars on that content stuff. And then we got these providers who eventually came on board: Caring, Pharmaniaga, now it's TMC, Colombia, Asia. They were all open to it. So that has resulted in some basic statistics that we were going through. We pretty much have close to anything between 70 to 90% of the traffic to the website, to our website, as compared to the others. Now, having said that, I don't know what their revenues are, right? They could actually have different business, right? Because we also have B2B2C, and B2B is growing very fast. while they could already have that. So that paid off, that right, to be a open platform rather than having a chain of pharmacies and then you be a telehealth on top of that chain of pharmacies, right, or on top of a chain of clinics, has allowed us to really grow unencumbered and grow in a very aggressive and free manner rather than asking your sugar daddy, can you partner with this clinic and that clinic. Even the other partners also will go like, wait a minute, if I put my patient health data records on your platform and you are owned by another provider, competitor, then how much to ensure that you won't be stealing my juicy patients, right? Be the high frequency and high value customers. So that approach has served us well, and I believe it's also going to do well as we go regional, right? We're getting a lot of partners telling us that this is the right model to go regional, right? As opposed to just being a chain, a big chain of clinics and pharmacies in Indonesia, Thailand, and so on, that don't quite get B2B very well, right? They don't have a customer service, key accounts team, a category manager to service this. What they have is doctors and pharmacists. Right? And they don't have a team that's dedicated to building API layers and do integration testing and so on with the customers, right? And also metrics, track the interaction. We are the third country outside US and China to actually get onto a program with Pfizer, in which we are going to help educate the public on many of the conditions which are associated with with this organization. So it's those kind of stuff that we really see ourselves growing.
Actually, you mentioned Pfizer. It reminded me of the COVID vaccines. Are you guys have any plans at all on supporting the government for distribution of that?
So I think what Hazwan was mentioning earlier, right? I mean, we got a call early in March last year to support the government for COVID-19 telehealth, right? In which we provided our platform, the government used our platform, and 5 million people came to our site and came to the Kementerian Kesihatan site, which is powered by DoctorOnCall. Now we are working with MHTC again to ensure that the hospitals and clinics, which are a bit behind the curve in digital adoption, they jump on the digital bandwagon, courtesy of just opening up an account on our site and just jalan lah, right? So of course, if you're Glen Eagles and Panta and some of these guys, maybe you want to invest into your own solution, but they're not masters of digital, they are masters of their own specialization, right? And I think similarly with the vaccines, we are building the solutions right now, and will be offering to partner, to support KKM, because I think like vaccinating 20 million, I believe, or 30 million Malaysians, right? Perhaps there's a chunk that may not adopt it unless you make it mandatory, but 20 to 30 million Malaysians will have to be vaccinated. And I don't think Kementerian Kesihatan can afford to do it alone. Just like how they're not doing all the testing on their own. It's a big chunk being done by private sector, because Malaysian healthcare has been a mix 50-50 between private and government, right? And of course, everyone has, and we understand, right? I mean, the people who should be vaccinated first are the medical workers and the people over 60, people with chronic condition. They got the highest mortality rate. But what happens if you want to fly to Singapore for business travel in July, and Singapore requires mandatory vaccination? I can see those, those advanced countries which are already rolling out, right? Malaysia is really going to roll out at the end of first quarter or perhaps second quarter. They are already rolling out now. So they'll be open for business and say, come in, Mr. Executive, if you have for this vaccine. Vaccine, and you might have to go there for medical reasons, for business reasons, for family reasons, right? And And so I suppose the private sector needs to jump in. We need to support them in terms of preparing for example, some sort of a health certificate, right? That is tamper-proof to show the folks in Amsterdam airport, right? That who's never heard of Malaysia or Kuala Lumpur, right? Or Kota Baru, whatever Kota Baru, that you did do a proper vaccination with KTJ or Pantai, or Mediburon and Qualitas. Yeah.
Okay, guys. Hey, thanks a lot for being on. It's been over an hour already. It's been fun talking to you guys. I guess just last calls in terms of where next for you guys lah, from DoctorOnCall, and also all for you guys personally too.
Yeah. So I mean, last point for me would be the fact that we're actually going for our first external fundraising exercise right now through Pitch In, right? And we should be commencing that in a week or two's time.
What's the funding for?
The funding for we are raising up to 5 million ringgit to actually help us build the next generation of our tech stack. Right? We want to really build an integrated healthcare exchange. There is no equivalent of MAPS in Malaysia, and when we have millions of people coming to Earth, I think we can be a de facto kind of provider, right, of this healthcare records and exchange, as well that bolts on all our solution on top of that, right, and serve sort of a utility rather than just from a commercial standpoint. That's one, but obviously it's going to create a lot of stickiness into our product, right? That will be a crucial thing. Some of it's also more content, because I think there's still a lot of underserved people in Malaysia. And the third part is actually developing a regional beachhead, right? So we'll be partnering with a couple of hospitals and insurers to go regional, but we need funding for that also. So this is our first external exercise outside, getting our own money, as well as some really great family and friends and some, old colleagues, right? All the old bosses who were giving us such a hard time decided to put in some money into DoctorOnCall when we raised a small round. So it's a vote of confidence. And so I think this is a great opportunity for people who I'm really taken by Pitch In, right? Because we've always been hearing about this startup, that startup, but you can never participate in it because you're not a venture cap, or you don't have 100,000, 200,000 ringgit as a high net worth individual or family office or whatever to put money and into some of the hot startups in Malaysia, right? Whether it's Policy Street, those kind of stuff, iHandal, and so on, so or Boost or whatever. So, but now this allows the retail customers 2,000 ringgit, 5,000 ringgit, take part in it, right? And hopefully get into a Malaysian growth story, lah.
Cool. Hazwan, what about you?
Okay, Amran. So, of course, before I started this, we've been spending time in the pretty much a glamorous world of banking and those industries, right? So for me, healthcare is fresh and new. There's a lot of things to be fixed and to be done in the industry itself, right? I mean, now that if everyone get COVID, like our healthcare system can't take everyone, right? So if another pandemic comes, are we ready, right? And of course, over the last 4 years, we've been convincing so many stakeholders, regulators, providers that digital is the way to go, but it was a hard sell, right? Now we need. I'm focusing a lot on the working with the providers and also new products that's coming up, looking at 5-10 years from now, right? What needs to be done so that everyone get a good quality access to healthcare, right? And we and digital is the way to do it, and we need to make sure that whatever that is needed in the next 5-10 years, we are there.
So no regrets jumping off and joining Maran then?
No regrets. A bit of a public service feel to it. Yes.
Wait until you get your unicorn status lah, and then have some millionaire shares. Hey, okay guys.
Hey, thanks, Amran.
Thanks very
so
much
for spending time with us on this lovely Sunday.
No worries. All the best.
Right, man.
Stay
Take
safe.
care and Same to you, man. It's gonna be a long 21.
Yeah, looks like it. Okay, man. Bye.
Okay, cheers then.